I've worked in the NHS in South East London for more than 23 years. And I've really developed my passion and my knowledge around kind of public health and behaviour change campaigns in the last few years. So this hub is a great way of kind of bringing in other people's expertise and sharing it with the community. So yeah, on that note, like I said, I've got some great speakers today. I'd like you to introduce yourselves if that's okay. So Nina, would you like to go first?
Thanks, Russell. Hi, everyone. My name's Nina Gavin, Director of Insight and Co-Creation at ICE Creates, and we'll certainly tell you a little bit more about our organisation and the work that we do in the field of behaviour change, and specifically today in application to smoking and vaping behaviours. Pleased to be here.
Great. Thanks, Nina. Adam?
Thanks, Russell. Hi, everyone. My name is Adam Rigler, and I am the Director of Engagement at ICE Creates. Similar to, as Nina said, we'll be touching a little bit more on the work we're doing in a moment. But again, a big part of the work we do is about sharing our learning and the work that we've been doing. So really excited to be here to talk to you all today.
Thanks, Adam. And John Paul?
Hello, I'm John Paul from Cannes, and we're helping a lot of ICBs and councils across the country at the moment run campaigns through channels that actually work. And I'll be sharing some of that data with you later on.
Thanks, everyone. I'm really excited about this webinar. I've done a lot of work on tobacco and smoking in the last few months in particular. And I'm developing a campaign in my NHS role in South East London at the moment. So I'm really interested to hear the presentations and discussions today. I mean, smoking and tobacco is very much a changing and evolving landscape at the moment. We've got, things like new drugs becoming available. I may pronounce these wrong, but like varenicline and cysteine. There's also been significant additional investment from the government in local smoking cessation activities, and we're getting close to the end of the first financial year of that funding. And there's been lots and lots of exciting activities happening, and I've seen that in the areas that I work in, lots of different things happening. But it is important that we try and join things up, and because I've also seen lots of duplication. And I think one thing not to lose sight of is the importance of investing in communications. In areas like Greater Manchester or Sheffield, they've really and we may have someone from those areas, I'm not sure, but they've really seen the benefit of investing in the communications. And their smoking prevalence has dropped significantly, and the really creative behavioural science-led communications that they've done in those areas has played a real role in that. And it's especially important when we know that most of the smokers that are left are quite entrenched. Many of them will have tried giving up smoking 10, 20, maybe even more times in the past, usually going cold turkey, again, which we know is they're unlikely to succeed. So then it's really important to try and get those people to the local cessation services so that they can be supported to help. As well as that, we've got some difficult comms messaging around vaping. We know that so we really want those entrenched smokers to swap the cigarettes to stop smoking, to a vape. But we really don't want young people starting vaping. So that's quite a difficult communications message. And then on top of that, we've got the Tobacco and Vaping Bill, which is likely to bring about, considerable changes to the whole kind of tobacco landscape. It is quite a broad and quite a complex bill, but some of the proposals in it, it will make it illegal to sell tobacco products to anyone born after 2009. And that, so that will be, a significant development. Stop the targeting with marketing and with materials of vapes and other products to children, and potentially to ban smoking and smoking in outdoor public spaces, and provision of vape-free areas outdoors. So again, once that is approved, and there are quite a few hurdles to go through, but there is broad public support for the bill, which is really positive. That's going to change the landscape again. On the bill, I will put in chat shortly a link to Ash, who've done a really good guide on the bill and what it covers and things like that. So I'll put that in there if anyone's interested in hearing more about that. But now I'd like to hand over to Nina and Adam. So I'm really keen to hear some of their insights that ICE have on smoking.
Okay, so welcome to our part of this webinar, and Adam's going to tell us a little bit more about ICE, but we're really here today to share with you some fresh recent behavioural insights that are helping us now in various places across the UK understand tobacco and vaping behaviours and how we're using that to influence some of the messaging and some of the call to actions around this topic. So I'm going to hand to Adam.
Thanks, Nina. So for those of you that have not heard or met us before, Nina and I both work for ICE Creates. We are a behaviour and culture change agency. We've been working at national policy, community, organisation and individual level now for 25 years. We've just celebrated our 25th birthday last week. We are a team of around 85 behaviour change specialists based across the UK, and we all passionately believe in our work that we do to build a more confident, resilient and healthy society. And a big part of that work for us as well is about taking our system role to share our learning, our skills, and bring as many people as we can on the journey with us.
Brill, thank you, Adam. And I suppose to build on that, we work right across public health, both at national, regional and local levels, whether that's understanding and changing behaviours in the domain of smoking, vaping, alcohol, those lifestyle behaviours, as well as some of our work with the likes of NHS England around increasing vaccination uptake, or whether it be reducing poor mental health and promoting positive mental health and well-being. Some of the work we've recently been doing actually in Birmingham, and good to see Birmingham colleagues join this call as well. As part of our approach through our ICE person-centred model, which you'll see here on the right-hand side, is we build those solutions through that process of insight, co-design and engage. We really specialise in taking our insight and our engagement out into the heart of communities, and that really enables us to amplify the voices of marginalised groups, those whose voices often go unheard. And by doing that, we're really playing our part in helping to close the gap on health inequalities. And then pulling that all together, as I say, through this model, we're using that insight to co-design and deliver interventions, deliver solutions and deliver services to help change some of these behaviours, including but not limited to the space of tobacco and vaping. Okay. All right, so today then what we're going to be sharing, again, it's just going to be a snapshot of some of our work in this area. I'm going to walk you through some of our insights into why people vape and what will help them stop. I know this is a really key topic at the moment for many different areas across the UK. So we're going to be spotlighting on one of our behavioural insights examples in terms of what we're learning about vaping use among young people. And then, Adam, do you want to say a few words about what you'll be sharing?
Of course, and then I'm going to just give a quick spotlight on a specific campaign and how we came about building that. For us, it was highlighting the importance between our marketing and comms activities and ensuring it lines up to the wider wraparound place-based engagement activities to work together in tandem.
Brilliant. Okay. Okay, so our first spotlight, as I've said, we're going to look at some of the key insights around vaping behaviours. And this has been captured by predominantly two recent projects that we've been running, exploring vaping use among children and young people. And we're going to look at this through the lens of the CombiBee model. I'm sure some of you are very familiar with this work from Susan Mitchie. For those who are not, I will briefly describe it for you. So this model of behaviour change suggests that for a particular behaviour to happen, it's more likely to occur if somebody has the capability. So in the case of vaping, that they have the knowledge and understanding and ability, confidence, skill to be able to stop. They're more motivated to do it than to not do it is going to be key. And we need to unpack what their motivations might be, some of which we will share. And they've got to have the opportunity to do it. Now, what I mean by that, by opportunity, is any of those factors that lie outside the individual. So the environment, so think of both the physical and the social environment. It really needs to be conducive to that behaviour. This is particularly challenging with vaping, given we all know it's so easy for children and young people to go into a local off licence and buy them. And it's very much the social norm. So the opportunity at the minute, the environment is actually probably more conducive to vaping than to not vaping. So we need to have a look at some techniques that can potentially help us shift the tide in that regard. So when a person has these three things, when they have the capability, the understanding, some of the skills and the resources to be able to stop vaping, they're more motivated to do it than to not do it, and the environment's more conducive. Together, they're more likely to have an increased intention and therefore more likely to achieve the desired behaviour that we want to achieve. So I'm going to walk us through some of the behavioural insights in this space by looking at it through the lens of the COMBI-B model. Okay. So firstly, let's look at capability, which, as I say, is all around people's knowledge and understanding and to some extent their confidence as well and having the skills. Now, what we've discovered from some of our recent insight is that people think if they can't quit vaping, and indeed to some extent smoking, that they're a failure, that quitting is on them. Now, what we're learning is that people's attempts to quit, they think it's on them and it's a result of low willpower. But we know that quit attempts are often undermined by addiction. You know, people don't often understand the extent to which addiction is at play here. And that results in them blaming themselves when it doesn't work, resulting in lower motivation and lower self-belief and confidence in their own abilities to quit. So we really need to change that narrative that it's not just about willpower and you're not a failure if you can't. We also discovered that there are knowledge gaps in better alternatives to vaping. Now, young people thought when we were speaking to them that vaping's better than smoking, but actually we think these snus pouches that have made their way over to the country, they're better than vaping. So vaping's better than smoking, sorry, but snus pouches are better than vaping. So actually we really need to be careful with the message around alternatives, because we could inadvertently move the problem from vaping to snus use. When young people talked about alternatives, they were not talking about your traditional NRT, your mouth sprays and your patches, but we need to think potentially about nicotine-free vapes in this space. But we need to be really careful, as I say, that people are thinking now that snus is an alternative for vapes, and we need to be careful that we're not reinforcing that behaviour. And let's face it, it's nowhere near as trendy, is it, to go out with your mates and go, come on, let's go for a vape, versus, oh, should we just go outside and have a patch together? It just doesn't quite carry the same emphasis. Okay, so when we think about what needs to happen in this space, and again, I'm just sharing some high-level insights that we're discovering, there's a real need to educate about addiction and how that impacts motivation so that people don't feel like a failure, as I've described. We need to educate on what those desirable alternatives are, and we need to make it easy for them to get those nicotine-free replacements. At the minute, it's not necessarily a conducive environment. It's not very easy to go down to your local off license and buy a nicotine-free alternative compared to buying a very colourful disposable vape that are often higher percentage of nicotine. Okay. So now let's look, our third component of the COMBI model is the opportunity. Now, as I've said, opportunity is anything that lies outside the individual. So we're looking here, what is it about the environment that makes it so easy to vape and difficult to stop? From our insights from speaking to these young people, it's the socially acceptable thing to do. It's cool, everybody does it, and I do it to fit in. Or actually, I just enjoy doing it with my mates. It's something that's become a social aspect, similar to what I guess smoking used to be. And then finally, so there's the social element on those first two bullet points. And the third point is around that actually the environment is so conducive to vaping because it's so easy for people to buy them. And it's so attractive. Look, I can get it in any colour, in any flavour. And it's just so easy to get hold of these things, which is why, in part, we have seen this rise in prevalence of vaping among this cohort. So again, when we're thinking about what needs to happen in this space, there is some work to do around reframing the social norm. As you gather, it is the social norm to vape at the minute among this cohort, but how can we reframe it? Can we use some recent statistics and make them relatable, bring the reality in? Again, from some of the conversations, I was speaking to young people and they were saying this, it was a young lad who was only about 15 and he said, but everybody does it. Like everyone I know does it, everyone in school. But actually, when we look at the statistic, yes, it's prevalent and people are trying it. But actually, the statistics tell us that 96% of young people don't vape regularly. And actually, the cohort of people doing it regularly, which is more than 3 times a week, and according to my data source, are doing it regularly. So thinking about how we can reframe the social norm, and also thinking about the use of influencers in this space who are backing not vaping. And again, it's not necessarily the parents and the teachers, but what about peers in this space? What about sports coaches? What about youth workers? And thinking how we can utilize those conduits into this target audience. And then finally, as Russell touched upon earlier in the webinar and as outlined in the Tobacco and Vaping Bill, there is a need for stricter legislation in this space. All right, final slide with some of these insights. So motivation. We know that people are motivated to vape because it tastes nice, it relieves my stress, it relaxes me, and it's cool and it's a really social thing to do. We know all that. We know what's driving people to vape, younger people especially. But what will motivate them to quit? Now, again, I'm starting to think it's not good for me. So we're starting to hear these stories come through from young people that, yeah, I don't think this is actually good for my health. Now, people refer to stories like popcorn lungs, and we'll have heard that term, but it's only when these young people are starting to experience negative symptoms for themselves that they're starting to catch on that, yeah, it might not be good for me. So we heard stories of people saying, as you'll see in this quote, actually, now when I get a cold, I think I'm actually worse with it because of my vaping. We heard stories of people saying, I find it harder to catch my breath when I'm at my five-a-side football club. So it's only when they're starting to experience those negative symptoms for themselves. And then the second point here is the cost. So yes, vaping is cheaper than a packet of cigarettes, but still, particularly if they're doing it, at least more than once a week, it starts to be a cost, particularly for younger people who might not obviously have an income. So what needs to happen in this space to harness their motivation? We need to be communicating and highlighting the immediate gains and benefits of not vaping for them. So more money, and thinking about framing that in a way of what could the equivalent be in terms of what they could buy with that money that they save. Think about better fitness. A lot of young people, if they're into sports or whatever it is, that can improve your athletic performance, and that could be quite powerful if it is coming from, you know, somebody like a sports coach who they trust and who they admire. And again, we know that people are not motivated by long-term health benefits. So we can't start shouting and going, do you know what, if you stop vaping, it'll prevent you getting lung cancer when you're much older. We know in the field that that's not moving people, and that's a bias in the field of behavioural science called hyperbolic discounting. I won't go into it too much now, but the long and short of it is that people are not moved by long-term health benefits. They're more focused on immediate gains. So what are the amplifying those short-term immediate negative health health impacts of vaping is going to be important, and making it real to them using some of those examples. Okay. Appreciate that that was quite whistle stop and just touched upon some of the key high level insights that are really starting to emerge in this space. We're still working with several local areas to now apply this insight to interventions, to nicotine reduction pathways, to communication campaigns, and we're very much live and in that space. So really keen, obviously, to share what's emerging for us. If anyone has any questions on any of these insights now or after the webinar, please do reach out. But for now, I'm going to hand over to Adam, who's going to share our second spotlight in this space.
Thanks, Nina. So obviously listening there a little bit around the motivations and the insight work that we apply to all of the work that we do, I wanted to share a little bit today about our approach to the wider engagement and communications that we deploy in our community stop smoking services, because for us, engagement and communications, they have to work hand in hand, especially when we're working with some of the targeted communities, as Russell mentioned at the beginning, where we understand that they have those entrenched behaviours and they're rooted in much wider lifestyle factors. So it might be housing, the financial envelopes that they're working within, their family dynamics, their employment status, and actually confidence levels and those value-led attitudes and behaviours. So we always recognise that need to really have that whole person and holistic approach. It comes across in the behaviour change coaching pathways, but that has to also be shared in the way that we deliver our engagement and our communication tactics and our marketing assets. So engagement and outreach activities for us therefore need that insight-led blend of both place-based and digital engagement. And at ICE, we have in-house teams where we can have that support throughout that journey. We have design and digital teams that are monitoring the engagement and the asset performance and styles. And that's all being fed from our grassroots engagement teams out working in communities with partners, and acknowledge as well the role that health coaches and the clients play when they're having their conversations on a day-to-day basis. It's all a continuous loop of intelligence and the ability to stay on the pulse, so we can then react to those messages and those assets to help find and connect with people. And there's also another level to this, which I think is really important, and that's about that system engagement, making sure that our communication and campaign messages are working across multiple programs and the wider work that aligns with partners, because our individual person or community groups might be having support and getting touch points with multiple services, and we found success of making sure that they're all joined up. So engagement and communication for us has to be anchored in the why, the where, and building the how. It's about understanding those motivators, the realities that people are living in, the plates that they're spinning. We have to find people and meet people where they're actually at. Where are those friendly faces and those friendly spaces, those trusted channels and trusted voices that can communicate the right messages for us in a much more impactful and meaningful way? And then building the ways to engage, finding those hooks or finding those motivators like Nina was referring to. What is it that's going to really connect and cut through with those target audiences and groups? So on the next slide, I just want to focus a little bit on spotlighting our 365 campaign. And this really, for me, highlights the need for not only a cross-channel campaign, but also that wider wraparound as an engagement tactics and messages as well. So for this specific piece of work, we were working with the county council on two pieces of work at the same time. So we have the children and family strategy development and also delivering the integrated healthy lifestyle service. So working across both of those pieces of work, we gathered a number of stakeholders and partners from community centres, food pantries and social shops to co-create with us a very sort of place-based Stoptober campaign to then anchor and echo what the national health messaging was going to be for that time period. We had to start with the teams and the volunteers that were working with the communities, and we held sessions with them to help them build their healthy lifestyles knowledge, confidence, VBA, to be able to hold those confident conversations, getting ready for once the campaign went live with the messaging and the interest and the engagement and potentially the referrals came through, that we had those place-based teams ready to navigate and support those individuals into the service or into those more confident conversations. It was also those individuals that really helped us with some of the different ideas and the very specific novel ways for some of them to really get the community involved. So a couple of our food pantries decided to put some buckets by the door with different coloured coins, and they named things health, family, money, to just ask people quite quickly and quite anonymously some of the motivators or main things that they're considering around their lifestyle behaviours, and in particular, potentially their behaviour or their motives to stop smoking. For other groups, they were able to do feedback cards to again throw some words and some things that they're thinking about in more of those in-depth interventions. The themes that came out of this was around feeling guilty, the position with finances, having to say no to their kids with certain things. It might have been around purchasing gifts, holidays, days out, and it was a big piece around Christmas for October, and that was at the forefront of a lot of people's mind about what Christmas might look like and what they could potentially afford. So we then tested these sort of key motivators and pressure points around that money for the local area and the price point around smoking. And it provided us with quite a relatable topic, because the media messages at the time was very much, as they still are, around that cost of living crisis and really building into that lived experience and daily pressures that so many of our clients were telling us about. We were able to then take this message and work with some targeted communities to get the same messages translated to really boost and increase the uptake and engagement with a few different populations in our community, the Czech, Polish, Romanian and Slovakian in particular. And it was really key for them because they'd worked with us and fed back to us that they often found with health promotion and health campaigns that what they received was packaged slightly differently, and they didn't want it to feel different. They just wanted it to feel clear, so that our campaign style, tone of voice and the resources were all uniform, so that there was that feeling of inclusion. But we were able to work with members of the community to translate the messages for us. So they had a real feeling of ownership behind some of these messages and the assets, and therefore they were the ones that were then distributing it for us, whether it was in their groups, whether it was Facebook closed communities, or even WhatsApp chats that they were using on a regular basis with their friends and family. Just to further this on the next slide, I've just sort of put together a little bit of a mood board of some other assets just to highlight for me. Oh, there we go. The key success for this campaign, as much as I'm sure you'll all be aware, when we hit Stoptober, we do see an increase in referrals and engagement around the topic of smoking. But for us, that wraparound engagement provided that boost in referrals with people who were ready to quit and that had that wraparound intervention before they came into service to really feel motivated and ready and informed. And we saw an average quit rate of around 68 to 75% across all of our services for those individuals that came through to us off this campaign. And that was because of the consistency of the message. So we know that money had the universal appeal, but for us, it was also how we were able to work across our partnerships to all share the same messages, assets, build in those confident conversations around the campaign. So it provided that extension from the digital comms and the resources to having those really meaningful social influencers, as Nina was referencing before, those friendly faces and those professionals and the peer support engagement opportunities. We were able to have access to job shops, the chatty cafes, the social housing groups and the community centres. Where we could help and provide with skilled support with toolkits, we did so. We made sure things were in-house printer friendly, knowing that many community organisations who really wanted to support didn't always have the skills or the access to budgets to be able to print a lot of resources. So we made sure they were black and white or low colour printer friendly. We distributed through partnerships to make sure everyone had the same tools and information. One in particular, which around the out of home campaign, and again, I'm sure for anyone that is working with public health communication budgets knows they have to make them work hard. Well, we were able to put an out of home banner with the ASDA community champion team, and it was able to move across all of the petrol stations and all of the car parks and points of sale to really make that one asset work quite hard for us. But again, I'm not sure we would have had the success of that without the early buy-in and the early adoption from some of those key community partners. So just to finally mention, this campaign brought together so many of those partners across the work we were doing. But it then also established a group of organisations who were gatekeepers, and we turned them into gateways of support. There was the training of the VBA, the signposting, and the referrals into the service. But it also then opened up those marketing channels and trusted routes to communicate and talk to people that we just didn't know existed. And that opportunity to then connect and collaborate expanded into a second campaign and a third campaign, really focusing on the different financial changes, the social changes, and the family health changes that probably wouldn't have been open to us if we just ran this as a pure communications and marketing Stoptober campaign. Because all of the activities across the place-based and digital comms tactics really helped us to further gather that intelligence. And I often call it was like rooted in the reality of what people were doing on a day-to-day basis, where they were and how they wanted to receive that information. So it continuously helped to sort of top up our understanding of that why, where, and how. So again, as Nina said, that's just a very top level of some of the work we've been doing. And there are many more examples as well, which we are very keen to talk and share about. So both of our email addresses are on this final slide, and I'm sure through Russell and team, we will share that out. But thank you all very much for listening. And if you've got any questions, I know Nina and I will both be very keen to carry on chatting.
Thank you, Nina and Adam. Some really interesting insights there. And we will see there's a few questions and stuff in chat. We will come to those when we finish, and perhaps Nina and Adam, you can have a look at those as well and think about how you might respond. I mean, I think one of the things for me is that is really important with any public health campaign is choosing the right channels. You know, you can do all of the science and get your messaging, you know, right, but if you put if your messages go out on the wrong channels, you have no impact whatsoever. And so that's something that that John Paul is, you know, an expert in, has very good ideas in. So I'd like to bring John Paul in to talk about, you know, some of the ways that people can reach, you know, some people can choose the right channels. Apologies. That's a bit more
amazing. You're doing so well, Russell. I think it's one of the croakiest webinars we've ever been part of. But yes, a big risk for smoking for any public health campaign, but particularly for smoking cessation campaigns, is that the majority of the target audience don't see your message. And that's partly because budgets probably aren't big enough, but also there are habits that we have as communicators that drain resource and deliver very little return. And so I wanted to slightly reword this as to say, I want to equip you now with an array of tactics that will help you help your colleagues to quit channels that negatively impact the health of your campaigns. So we all want to run something that works well, but we find ourselves frequently being presented with this, a straight to tactical approach. We want to have ads on bus backs, we want to have ads in supermarkets because someone's seen it somewhere, and that's what. Now, as professional communicators, our job is to guide, advise strategically to ensure that campaigns deliver a measurable outcome and a good return on investment for the campaign. And part of that is absolutely getting the right insight, understanding behaviorally where your target audience is. Also then creating a suite of stories and trusted voices and people, exactly as the IC guys have been saying, to then be delivered to the target audience. But then you get asked to do one of these tactics, and here are some things that I would suggest you can potentially share with people. So in the public sector, we're not in a position to do everything we want to do. So there are choices to be made. A good way of filtering out things that we might have a hunch is something that may be good for elected members and may be good for people who want to see their campaign being famous, but we know may not target the target audience. I always ask, that sounds great. What proportion of our target audience does this channel reach every single week? What was the cost per outcome from a previous campaign? So what was the cost per quit attempt registered and attributable to bus advertising last time we did it? Oh, Sky AdSmart sounds interesting, or radio sounds interesting. Have we used it before? What measurable results did it achieve last time? Now, there'll normally then be some sort of fumbling or the production of a PDF or something like that. But if the answer to any of these things is, I'm not sure, I don't know, we need to then take that person on a bit of a journey. Okay, and that's a journey in terms of telling them, helping them understand what channels are. Now, many of the people we might be convincing, predominantly in their minds, still think that advertising is like this, but actually advertising now is potentially targeted, potentially much better value for money due to less wastage, and potentially measurable. And the consumption that we're actually trying to target looks more like that, and is on those kinds of brands in those kinds of places. That is the vast majority of consumption of information across news, across social, across search, wherever people are online. And you're able to target individuals with rules or programs, hence the term programmatic advertising. So we don't need to spray and pray anymore. We don't need to do above the line broadcast. We can be laser focused on specific age ranges, specific locations, specific times of day, specific trigger points. And this is an absolute dream for delivering behavioural interventions. And so this new possibility is something that you think, when tried, would work fairly well. Well, it works a bit better than fairly well. What we want to do first is to stop the investment in the things that we've done before and haven't seemed to work. So if they say we don't know, we're not sure, it's hard to say, it's going to be really hard to make the business case for investing in that channel without that data. That should help you park it for a bit. Or you could say, how much should we cut from proven tactics to fund this channel? And that will hopefully then give you room, or all the budget, to invest in proven tactics. Now, this may not be a surprise to you, but when we run campaigns, and this is data from a recent campaign, all of the paid programmatic advertising, the paid online advertising, about £20,000 worth of investment delivered almost 30,000 click-throughs and interactions. Everything else getting on for about £60,000 investment in out-of-home radio, print, direct mail, and so on, delivered a cost per click of £81, and that's a significant difference. I just want to get people, I think sometimes data doesn't change minds, unfortunately, but it's worth getting into people's minds. If I rung you up and said that I would improve the effectiveness of a campaign by a factor of 2.7, so almost 3 times the outcomes, you would say, yes, let's do that. Let's divert all spend to that. If I said I would increase the effectiveness of your campaign, I will reduce the cost of the quit attempts in your campaign by a factor of 27, you'd find it really hard to do anything else. Because we don't have enough money. We want as many quit attempts as possible. Let's put all the budget into this. That was 277 times more effective. That makes it really, really hard to justify taking £1 away from something and making it 300 times less effective by investing in another channel. So whatever we can do to walk people away from things that we kind of know don't work, but we understand why people like them, but they don't deliver a measurable outcome. And then all of the heavy lifting being done by a small proportion of budget channels that do work. And we need to walk them towards doing a little bit of the stuff that makes them feel good. And that's absolutely fine. Ideally, it's free through council channels, or like that brilliant thing that ICE did with ASDA, those kinds of partnerships. Yes, 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 do all of those. If it's low cost, it's fine. But reserve the majority of the budget for being on Snapchat, being around search terms related to intent to quit, targeting groups of family and children to encourage long-term smokers in their household to attempt to quit, putting stories about people that moved from thinking they would never give up to having give up and what that means for them now, all the drivers, and pushing that out frequently, always on, not just around little blips around the year. That wrap-around intervention towards the communal quit month is useful, but you can't predict when people are going, when it's going to be the right time for them, when they have that horrible cough or that cold, where they have all those situations. So being there constantly is really, really important. I'll show you this campaign a little bit more detail that shows some of these tactics working. But we're, just to be absolutely clear, we're diverting spend away from out-of-home, buses, radio, high cost per outcome channels towards free and owned channels, so councils being incredibly powerful media owners, search, remarketing and social. This is an example of a campaign where there are a few things at play here. One was the installation of a really simplified, accessible custom landing page, which is why you can start seeing results as the campaign moves on. But it was also the installation of advertising in council emails, which this council has done for the first time. Well done, Warwickshire. That's using their own channels to do it. We're also remarketing to people accessing benefits pages. So people who accepted cookies on pages related to benefits, and I think potentially adult social care as well, we were remarketing to that audience. So when they left the council site, they then started seeing, excuse me, adverts nudging to them to this really simple landing page. So looking at user experience, getting the right platforms brought into the plan, letting those platforms optimize. All of these tactics mean that you can deliver cost per click, cost per interaction many, many, many times lower. I say at least 10 times lower, but as you can see, it could be up to getting on for 300 times better, which means more impressions, more opportunities, more prompts to quit across what you're doing, which will mean in the end that we have more outcomes for your budget. So hopefully that's useful in terms of being able to walk your colleagues away from channels that will drain budget and deliver no outcomes and move them towards an always on, low cost per outcome campaign delivery. Russell.
That's great. Thanks, John Paul. We will come to the questions in a few minutes. So again, I'd urge John Paul, if you can just have a look, you've just been speaking, to see if there's any that you want to respond to. Just a thought. I can see this stuff coming in along this already. I'm really keen. I mentioned earlier, there's duplication happening even at a local level, but there's this. Well, for a start, there are 60 odd of us interested in this today from all over the country, I'm sure. I think there's real scope here for the Public Health Comms Hub to try and collaborate and share some of our learnings around smoking. I've seen a really good example. I did a blog about it for the Public Health Comms Hub recently around foster care and local authorities recruiting foster families. Now there are over 100 local authorities working together on that at the moment and putting small resources in together to develop shared creatives, to use the science to frame their messaging and things like that. And I think there is a real scope for that. I think it is something we could definitely do much better. The real key thing is evaluating. There's no point doing any communications campaign without evaluating it properly, and having access to that data to be able to measure is really important. And I just like to put it out there that we'd potentially like to set some sort of I don't know, a group up, or some way of sharing amongst different areas, insight, results, evaluation, potentially, pooling resources to develop creatives based on that insight. And yeah, just put it out there that if anyone's interested in exploring that a little bit further, we'd really happily, develop that idea. And yeah, and John Paul, did you want to come in on that?
So what we found working in other areas, I see Adrian asking about vaccine. We also had some experience running recruitment in other fields, and it's been really useful to benchmark campaigns. And so we've got a bit of experience in the background pooling together concurrent campaigns and comparing cost per outcome between them. Obviously, you need to compare yourselves with similar locations and similar audiences. But what we can do, and what we'd be happy to do as part of this hub, is if you can share live campaign data that you're running around what's working well, actually all the campaign data, we can then collate it and compare for you tactics, channels, and then brilliantly creative and messaging that's working. And if you're in that group, you'll be able to see where you're doing really well and where you could borrow from that group to improve your performance. It's one of the unique superpowers of working in the public sector, is that you can share data with other organisations like you in a way you can't in the private sector. And it's really helped, particularly in fostering, accelerate the optimization of campaigns. So if you've got a campaign running at the moment and you have live outcomes and campaign data feeding in, we're going to start a group with some of the smoking campaigns that we're running, and we can add you to that pool and then start feeding back on a monthly or maybe quarterly basis as to what's working well, and you'll then be able to borrow those tactics for your own campaigns as a result of it. And I think then some of the information on creative messaging that comes out of it would harness that sort of network intelligence that this hub could be a useful thing to create. So if that's interesting for you, there'll be no cost, but if you can get in contact with Russell, and then we'll let you know how to supply the data, and we can go on from there. But yeah, please just drop Russell a line.
Thanks, John Paul. And I can see Finn has offered to share some content and creatives, which is great. And also there's an offer from Adrian around sharing some vax insights. Sorry, I thought it was no smoking. Yeah. Sorry, I'm getting a little bit muddled by some of there's quite a lot in chat, which is great. One question around, and I'll see if others have got an answer on this, but a question from Adrian again around the focus on increasing vaccination and uptake, and is there anything to learn from smoking cessation work? I mean, others might have more, but I think that the two really obvious things that have come out from today is around, taking a behavioural science-led approach, looking at and trying to develop your behavioural insights and using that to frame your messaging, but then also making sure that you use the right channels to reach your target audiences, and and that combination should yield good results, really. Anyone else want to come in on that question?
I would just add to that, Russell, that in addition to the things you've just mentioned, there's also a need to tailor these approaches to different target audiences, and we cannot treat cohorts of our population as homogenous groups, because what's driving a young person to vape or smoke might be very different to a middle-aged man, for instance, who's a routine and manual worker. And we need to always, again, coming back to the importance of those behavioural insights from cohorts of the target population whose behaviour we need to understand in order to then change.
Absolutely, yeah. And there's a question which I wonder if John Paul's come back in from Greg around digital channels being busy where messages can very easily get lost and can be quite difficult to interpret what impressions, interactions and click-throughs actually mean and according to Spang.
No, very good point, and I totally take your point about busyness, particularly with organic social media. Social media used to be a neat way of getting a lot of basically free reach, and that's changed over the years. And a lot of organic social media reaches less than 1% of your target audience. I also agree that large numbers on paid media, what does that mean? Well, that's why you've got to correlate campaign interactions against quit attempts. If you're not doing that, you're right, it is meaningless. And unfortunately, there are many instances of either under amplified campaigns or campaigns that are amplified, but those interactions aren't then correlated with quit attempts or any other outcomes. That's why it's so important to get into the data and get to those graphs, but then critically simplify it. I've learned the hard way that going far too nerdily into too much data actually switches people off. And what you need to do for key stakeholders is show, here's what was happening, then we communicated, then these outcomes started happening, and then over time, our cost per outcome went down as we optimized. That is absolutely essential for making the business case for ongoing investment in communications, for making the case for always on health intervention, which behaviourally is the only way of doing it, and for demonstrating the value of you as a comms person to the strategic priorities of the organisation that you're in. So yeah, it is tricky. It's about doing it right, getting the plumbing in place, then filtering it, making it simple and communicating that information. It's like doing your own internal PR, your comms as it were, to make sure that people understand they're getting real value from listening to you and from giving you control over what they do.
Thank you. This is a question from me, not from the chat, although there was some chat around this, and it's a question for Nina. It's really interesting to hear your insights around vaping and kind of that messaging. But for me, it's a real delicate balancing act, isn't it? And how do we tell young people about some of the health implications of vaping without putting smokers off switching to vaping? And is it just in the targeting, or is it in different messages for different people? I don't know. Any thoughts?
I don't think it's just one of those things. I think there are competing factors, and I think you know, some of the work that we're actually doing is around testing some of these things. I don't want to stand here and go, oh, this is absolutely the way to go with it. I think we're in the stage now where we're starting to gather some of the insights in this space. And I know there's somebody on here who was talking about some of the resources that they're trialing. So I think it goes back to the need to not only gather the behavioural insights, but we then need to test and refine and experiment with it to determine how best to play it with some of that, Russell. So I'm afraid it's as with behaviour change, it isn't a straight answer with some of this. We're dealing with people's behaviours, and there are complex factors at play here, but we'll be certainly delighted to share some of that as we continue on our journey in various areas of the country to start to test and experiment and refine with some of these interventions. And as we've gone back to the importance of evaluating as we go, so that we can understand what bits are working and what bits are not.
Yeah, that's great. And I mean, I think it's a real example of where, you know, as a community, we could share insight and testing results and evaluation and you know, rather than all trying to do our own things, it could make so much sense, couldn't it? Okay. Okay, sorry, I just got distracted by chat again. Are there any closing comments from any of our speakers? Otherwise, I'm going to draw the webinar to an end. John Paul?
Just thank you to IC for sharing those insights. So valuable to have them and to help shape our thinking. Brilliant for me as well to see, okay, I can see which channels are going to work well with this. And it would be brilliant for people who join the benchmarking group to share and sort of accelerate performance together. And thanks, Russell, as well, for putting this together.
Yeah.
Thank you. Adam, anything from you?
I think just to echo really the couple comments in the chat, which I think is really important, it's making sure that we're anchoring the output and we know what we're sort of going for, because it can mean different things to different people. And knowing who we're communicating back, knowing what those sort of metrics and benchmarks need to be, but also not being afraid to do things slightly differently, because everyone is very different and our communities are very different and they respond to different things and they have different channels and different trusted routes at their disposal. So I think it's be curious and be brave to test and trial, and as long as we're learning from it, then that's always a good thing.
Yeah. And Nina?
No final comments from me, just echo everything everybody's said. And as I say, any other thoughts, questions as we leave the webinar, please don't hesitate to reach out to Adam and I or the team at Can Digital as well.
That's great. Thank you. I'd like to say a massive thanks to the three speakers. So Nina, Adam and John Paul, that was really, really interesting. And thank you so much for everybody who came today. It was great to have so many people here. If you have got any questions or if you are interested in joining up as a community around smoking and tobacco, then please do let me know, and we'll be in touch. And we'll be in touch within the next few days with a recording from today and the materials from today. So thank you, and we'll see you next time.